Welcome to the DNA Talks podcast, where we take on the mission of unlocking the code of your genetics. This season is all about you, upgrading your health, not just on the surface, but down to the root cause. Join us as your clinicians at the DNA company investigate your DNA and beyond. The intention of this podcast is to enhance your lifestyle by changing what is in your control. This does not substitute the medical advice given by your personal doctor, therapist, and other healthcare professionals.
Hello, and welcome to this episode of DNA Talks. Today, we're following up on a conversation we started a little while ago regarding the death of Matthew Perry, and more specifically, the medical system, the pharmaceutical system, the social system that enabled and led to that very tragic loss of a life, which, while typified what is going on, is seen in so many other instances and so many other people in so many other places. We're ensuring that we have a well-informed, multidisciplinary conversation. And so allow me to introduce this illustrious panel, all of which have different perspectives and different passions when it comes to this. First, I'm joined by the CEO of the DNA company, Ms. Tracy Wood. I'm also joined by one of our premier clinicians, Dr. Lara Varden. I'm also joined by another one of our wonderful clinicians here, Dr. Tiffany Smith. And last, I'm joined by our counsel, at least on the Canadian side of the border, Mr. Tahir Khorasanee. Welcome, everyone. Thank you for joining us today.
Good morning.
Yeah,
Hello.
and I wonder if we can start and set the stage by offering just some statistics and some context as to what's going on here. Let's put some numbers behind the very vague statements of poor prescribing practices and social networks that enable such things.
Sure.
Yeah.
So one of the things that I uncovered in doing my research for this conversation is that 220 people die every day just in the United States from a opioid overdose. Now, it's important to know that at one time, the number was all encompassing, whether you had a prescription and died, whether you bought it illegally and died. The CDC and the Department of Health did not see a distinction between those two things. Because this has become so out of control, they now have a distinction of, well, 40 people in the United States that have a prescription die every day. So those are people that legitimately were allowed to have that drug. And then 220 didn't legitimately have that drug.
Yeah.
And they're also trying to now start to separate fentanyl overdose from opioid overdose, as if that, again, makes a difference. It doesn't. The fact is these drugs that are very easy to get, as we see with what happened to not just Matthew Perry, but the list of celebrities before them, these drugs are easy to get. You can get them at any party. You can get them injectable. I mean, people now are saying, oh, well, you can inject ketamine for behavioral health and all of these other things. And while I think everything has its place, and I'm not a doctor, and I certainly I'm not even going to pretend to understand any of that. I will defer all of that to Dr. Smith, who has an unbelievable amount of expertise in this space. It still is. It comes down to that personal accountability, that personal responsibility, right? It's like somebody that says, well, I don't really drink, but I'm going to have a glass of wine if I go out to dinner. And they have a glass of wine and they drive home and they're perfectly fine. And somebody else that goes out that really shouldn't be drinking and has 10 glasses of wine and then kills 3 kids on Pacific Coast Highway, right? There's not a difference. The alcohol is still kind of at the center of the issue. Same thing with opioids, same thing with oxy products, same thing with phenobarbital and barbiturates and the Xanax drugs of the world. It's the same distinction without a difference. It's the same thing. And I think that's part of what we need to talk about today. Tahir and I were talking about what happens when these people get prescriptions that essentially kill them. If you look at the celebrities, I mean, Tahir, you look at the celebrities, what kind of what kind of time do they get, if any? What kind of punishment do they get, if any, if these doctors are treating and treating these people just for profit and gain?
Right. So Canada is relatively more regulated than the U.S. and health especially is entirely in the public domain. So let's imagine for a second if Matthew Perry's case was in Canada, let's say in Ontario, where I'm based out of, not in the U.S. Um, the first thing that would happen is the doctors would be charged with either overprescription, which is prescribing more than what is medically necessary, or prescription fraud, which is prescribing without a legitimate purpose. In addition to that, they would be charged with conspiracy because they're all involved in this sort of,
Right.
sort of a conspiracy. There would be prosecution by the College of Physicians and Doctors as well. So they could possibly have fines, suspension, or their license
Okay.
will be revoked. And they will face lawsuits. In this particular case, it would be wrongful death lawsuits as well, and possibly punitive damages. So quite a lot can happen, but unfortunately, even despite all of that, you have Matthew Perry, which so sad that it was October of last year that this happened. But the list goes on and on. You have Michael Jackson that also suffered because Dr. Conrad Murray, who is his personal physician, administered a lethal dose of propofol. And so in the US, Dr. Murray was charged with involuntary manslaughter for administering the drug, was sentenced to 4 years and released in 2. You have Tracy, you talked about fentanyl. You have Prince, who died of an accidental overdose of fentanyl, and no criminal charges were filed against his doctor.
Right.
And he did settle a federal investigation. So he settled a federal investigation. In exchange, there were no criminal charges, and the plea deal is not, openly and public, so we can't scrutinize it. And you'd be surprised, he agreed to pay $30,000 to settle allegations that he violated the Controlled Substance Act,
Mm-hmm.
right? Anna Nicole Smith, both doctors were charged with conspiring to provide drugs to a known addict, and they were also charged with other prescription-related crimes. And here you had sedatives and painkillers involved in an overdose in 2007, convicted of a misdemeanor. And in the U.S., misdemeanor means small crime, okay?
Right. It's
Um,
nothing.
yeah, it's not much. And Dr. Kapoor, who was also involved in this, was acquitted of all charges. Elvis Presley, famous case. Here, what happened is the doctor made a deal with the governing body to surrender his license in exchange for not having any criminal charges. Heath Ledger, Tom Petty. So the list goes on, and the reality. So I don't know what's not happening correctly, but I can perhaps talk about some of the legal challenges that are involved in prosecuting these claims. And the first is, and we did discuss it before when we were preparing, and I think it was Dr. Kosterman who said that medical professionals tend to argue that they were acting in good faith, that they were trying to manage pain, that they were trying to manage other symptoms. Okay, and when you're talking about criminal intent, that type of argument is a very strong argument to put up. Another challenge is, of course, there are plea deals as well. And the third is there's often very complex medical defenses, because often these individuals have a variety of medical issues that are going on behind the scenes. And we talk about that in our podcast all the time. Variety of medical issues, and lawyers are very crafty in figuring out which 2 or 3, either independently or combined, could have caused the death. That tends to be a good defense. And then one challenge is, as with Elvis Presley's doctor, is that doctors come with plea deals. They have great legal representation. They're willing to surrender their license, and they're not criminally charged. So those are some of the challenges.
And I think part of I think part of the intent piece, right, that calls for the operation as somebody else's mind. You can't necessarily prove that to a level of certainty beyond a reasonable doubt, and then you don't meet that bar and that standard that's required in criminal court. But that's why it's easier, right, to meet the bar in based on a preponderance of the evidence, which is what's required in civil court. And
Yeah,
to kind of speak to your point and ask Dr. Smith, doctors don't generally start out trying to find a way to make money off of a celebrity. Doctor starts out with good intention. Doctor starts out with first do no harm and to create that clinical environment that the patient needs. Matt Perry, 25 years ago, when he was on Friends, he had a Vicodin addiction. And in fact, it really interrupted that show, and the show was very popular, allegedly. I don't know. I don't think I ever watched it. But during that time, his behavior became so unmanageable, they actually took a hiatus. They got Matt some help. Now, fast forward to recently, and Dr. Smith, I know that ketamine is being used for anxiety and things like that. And that's what he was allegedly being treated for because of his anxiety, because of these issues. Wouldn't you, as a practitioner, look at that and say, listen, you had a Vicodin addiction 20 plus years ago. That's an opioid. I'm not going to treat you with another classification of the same drug. What are your thoughts to that?
You're 100% correct. I mean, I think when we talk about legality, I think that's something that you could call out and say, look, I know you had good intent, but in looking at the history, there was maybe a deficit in your knowledge base or something that made you go ahead and prescribe in that same category when he already struggled before. And there are many options to manage anxiety. Why did it have to be that? So it seems to me like it would be easy to bring up a charge in that respect, because there's history you can make a decision on. It wasn't the first time you had it and it was too much or something. There's history. So I think that could stand up legally in a court. Tahir, could you kind of elaborate on that? Because to me, it would make sense. I could call you out and say, there's this history. You made this decision when you could have chosen an antihistamine to manage anxiety versus going to this extreme. Is that something that could be legally held up in court in that circumstance?
So, Dr. Smith, this is perhaps one of the biggest challenges in any medical malpractice claim, is that you have to prove that this is not one of the many things that is sort of outside the bounds of what a doctor would do in this situation. So, as you know, the human body is so complicated that if you have a particular symptom, you might treat it 4 different ways. So, in order to prosecute a doctor, you need a doctor to say that what he did is not one of the 4, that this 5 is not part of the things that we can do that's reasonable. So it's not sort of a standard of absolute correctness that this is what I would have done, right? Rather a standard that, this is not what I would have done, but this is reasonable in the circumstance, and that's where doctors tend to get away. If you can find another doctor to support you, you're free, and doctors tend to stick together.
Well, and if you look at Matthew Perry's case, Dr. Smith, Mark Chavez, he already pleaded guilty. He's facing 12 years right now, right? And in California, he'll do, 3/4 of that time or less, right? But the other doctor, Dr. Placina, he's pleaded not guilty. Even though he was a part of that business record that they used to see what was going on between the practitioners, all of that will eventually come out in open court. And while, again, everybody is innocent until proven guilty, at the end of the day, one of them's already pled out, and hope, like what Tahir just said, he can say, hey, that was one of the 4 choices I had, so I took that choice. And, I knew nothing about his former history. Well, all you have to do is look it up. If you've got a celebrity client, we've got, celebrities that come to our practice here. A lot of our practitioners treat them on a regular basis. They go through their genetics with them. It's not that tough to just Google somebody's name.
Right.
Yeah, I think,
right?
yeah, and if I may offer, I think this really brings in the human element, the human negotiation that happens between doctor and patient, right? So a patient presents themselves, they have a history, and they're saying, I'm really struggling with this, but I need this. And that almost begins that negotiation. So the doctor is then presented with a decision. I can start working with them in light of this history and see how can we navigate it, wean them off, or whatever it might be, right? Because it's not infrequent that a patient will present to a doctor already on a litany of medications that the doctor might disagree with and say, okay, let's look at harm reduction. How do we start reducing this? And that could be the initial intent.
Sure.
The other option could be, I am not open to doing this. The patient says, great. They may try and negotiate. If that negotiation does not work, they will go find another doctor,
Right.
right? And
And
there's
in
an
the
element of
celebrity
doctor
environment, there's all too many of them that are willing to do that. I mean, there's a lot of
Absolutely.
reasons for that, right? Dr. Smith, it's the environment, right? The people outside that are not using, they can become addicted to that energy.
Yeah.
Yeah,
Yes. One thing that we have as providers is we have a monitoring system where we can check what controlled systems have been prescribed by other prescribers. So so like they talk about doctor shopping. I can see if you've been to 5 doctors and they all gave you Ativan to help protect me not following into that when you come and you give me the tearful, sad story. So there are ways that providers can see what other providers have written. Now, I'm not sure how the celebrities and all of those at that statute could circumvent that. I mean, I know there's ways, but at least on a dealing with the regular person, we can check and assure and make sure we're not being a part of the problem by just continually prescribing, by checking to see who else have written prescriptions as a way to help protect the public and offer the best solutions possible. We can see how much has been written in the past. Like you said, back in 2012 or whatever, you were on Vicodin. I can see that in these records and help me make an informed decision. So I can start with the least controlled substance and then we can go from there.
is that part of how the PBM system works, doctor?
Yeah, PMP is what they call it. In Nevada, I think it's the same in a few other states. Not sure about others, but yes, that's how it works.
Interesting. So in theory, and again, innocent until proven guilty, in theory, these doctors would have had access to, as long as Matt was getting his medications in his name, they would have
Right.
had access to the entire history.
Mm-hmm. They could have
And
seen what could, yep.
if a celebrity comes to you and says, make my prescription out to Tahir Khorasanee, which is my real name, and you're sitting across from him going, that's not who you are. As a doctor, are you going to pump the brakes on that? And are you going to say, hey, I'm not writing this unless I see an ID that says your name's Tahir Khorasanee?
Right. I would have already had the ID and verified the individual. So the answer is flat out no.
Yeah.
This is who you've been legally identified as being and have, your chart, everything that I have is based on that. So therefore, that is who I'm treating.
Right.
Unless you provide me some name change documentation or something else.
And with
Matthew Perry.
Sorry, Dr. Martin.
Sorry, Matthew Perry in several interviews in his book, he talks about how he went to other doctors, to get, okay, how many pills do I need for, this length of time? And he said, actually, it's all math at that point of what he could get. But I think that there's still a lot that is being focused on in the branches and the leaves instead of looking at the root cause problem. Why was he searching for that in the first place? When you start looking back at his whole history, I mean, his mother and father got divorced when he was still a very young child, and then having to move from, US and then lived up in Canada with his mother. And you could see the history of the issues, getting into fights. He actually physically hit Justin Trudeau, when they were younger, Prime Minister of Canada now, so
Yes.
there were already issues. And he was talking about that he started drinking at 14, that, he was using a lot of alcohol. But again, he's already going down that path where I think if he had some sort of intervention or help really looking at why is he turning to these ways of satiating whatever pain, fear that he is going through. If he had known his DNA, looking at the pathways, knowing how, his dopamine works, his serotonin works, how his detox pathways work, how, what is he set up with? But unfortunately, that kind of information was not available, 20, 30 years ago. It's just so unfortunate for all of these public figures, these famous people, that you see a common theme that can go through many of them because there's so much trauma, pain. And he kept thinking, because the main thing that he was stating is, I want to be famous. I want to have this position. But then when he got it, he's like, this isn't fulfilling. This is actually a lie.
And
Exactly.
I would offer, Dr. Varden, I think while Matthew Perry typifies much of it, I've seen within my previous practice, at least, which was in an integrative clinic where there were prescriptions being written, it is very common for people to be on substances longer than they need to be. And not so much that the doctor is enabling it, but there's a little bit of, we don't know what to do. We don't know how to discontinue. There's no safe discontinuation. So it's almost a monitoring, but then that doesn't guard for, can you get it from outside sources, right? I think while Matthew Perry typifies it, this is a very common problem within medicine that we as doctors, as individuals, and then we as a medical system do not know how to address. And this is how it's continued to be enabled, right? The legal conversation is so important because there's an element of, the rod will teach doctors, right? You do this, you get tossed in jail, it's going to stop you. That being said, there has to be a death for that to happen.
Right.
There's not really a network and a structure to get to the point where we avoid that death.
And for every one celebrity that dies, we're losing 10,000 other people.
Yeah.
Right.
They're just the popular.
Right. You're only hearing about Michael Jackson because Michael Jackson was Michael Jackson. Same with Elvis. Same with Anna Nicole Smith. Go all the way back to Marilyn Monroe. Marilyn Monroe was treated and treated by the rich and famous doctors in Hollywood. She got barbiturates and it killed her. And people go, oh, well, maybe she was suicidal. Okay, maybe she was, but was she seen by a doctor? And Dr. Smith, you deal with patients in the mental health space. You deal with patients that need prescriptions in that space. As a practitioner, if you're sitting across from somebody that you think is suicidal, you're not going to hand them the gun.
Correct.
Right?
Correct. What I'm really hearing, I hear the limitations within our healthcare system. And I think that one thing that needs to be more aware and what we have to work on is having that connectedness between our healthcare system and wellness. So when we talk about DNA 360, the healthcare system doesn't provide that, but we have a whole slew of practitioners that have other approaches that can pick up when it's time to get off of pain meds and your benzodiazepines and all of these things. So while the medical provider has its box it stays in, I think that they have to recognize there are other resources. We have the internet. We have ways to learn who else is out there that can help you with these, from here on out, because I'm only writing 14 days of this or 7 days of this. Now I need to move you on to someone else who can give you other options and ways it can be managed in a non-abusive particular kind of way. So we need to bring that together. Go ahead.
Yeah, no, like you said, you would never have given him the same classification of drug when you knew he had a history 20 years previous. You're
Correct.
just asking for trouble. You would have found alternatives outside that classification because maybe genetically, to what Dr. Varden was saying, maybe genetically he was predisposed to addiction. Maybe genetically, that was how he was built. So the practitioner should have looked at that and said, listen, 20 years ago, we had a problem. I think we should try an antihistamine or some other classification of drug, and let's get the same outcome, right? You want to have that anxiety quashed. You want to still be able to be a productive member of society. You want to be able to continue to work in the space that you're passionate about, and we can help you do that. You don't have to be high to do it.
Right.
Yeah. I
Exactly.
mean, it was sad. You saw did you guys see he did a post right before he died,
Yeah,
where
in
he's
the hot tub.
sitting in the hot tub. He's got some funky drink or whatever, and he'd already been injected.
Mm.
And it's like, dude, you can't mix these two things. I mean, where are those conversations? And the fact is they don't happen. And to Dr. Smith's point, Dr. Smith only has that one frame of reference. All they can do is look at that frame of reference. But the PA that was in Matthew Perry's life, the PA that was in Prince's life, the PA that was in Elvis's life before we called them PAs, all these people knew. The well-intended external influences that when Prince said he wanted to be loaded, he didn't walk into Walgreens and pick that shit up. I don't care what anybody says. He's not going to go walking in there. He'd never been to a Walgreens in his life. So, I think that when you look at the well intentions of people around the addict, around the person that really needs help, is your job really worth that much to stay a PA when you know you're going and picking up stuff that's going to kill this man? I don't get it. And Dr. Smith, I know you see a ton of that. And we talk about this all the time in our clinical team meetings. It's those influences. What do you do with that? How do you, if you're the addict, how do you, if you can, manage that? And how do you, if you're the PA or if you're the mom or you're the sibling, how do you manage that and turn around and say to somebody that's larger than life and Elvis Presley, dude, you're a drug addict and we need to clean your shit up? How do we do that?
That's a good question, and not being a part of that world. I can't imagine the amount of pressure it is to just go with the flow, to be the one, the oddball, would you be accepted? I think that there's a point you go in the individual, I'm hurting, I need something for pain so I can live my life and be the best I can be. And you're searching for that. But then it comes a point where I need this fix. And it ain't about being the best of your life. And if someone, when their intentions are, I'm just trying to be the best individual I can be, that's when they're receptive to options and other things. And then when it goes beyond that, it's going to be an uphill battle. It has to be them wanting it. And I think that it's timing when you have people around you and you're in that affluent life where you can have whatever you want, having the right people around you from the beginning, from the start, to help you not be led astray, to be looking over your shoulder saying, I think that's too much. You've had 3 doses of that today, and I don't think you really needed it. Something like that, to have that conversation.
This is where I found it very interesting that Matthew Perry had said in an interview that he said the question was, how would we know? What would you say or do that people would know that you need help, or that you could go down that path of, taking more than you need, or doing this not under a prescribed oversight? And he said, if I say that I just want to be home alone and chill, or that I just want to, kind of be by myself, that is his scream for help. And that for him to be able to verbalize that and say specifically that, those are the kinds of red flags. But it just goes to say that he needs someone. When he's by himself, he doesn't trust himself, even though he has said in the past that, oh, well, if my good time or my happy place is being home watching a movie, not going out partying and jet setting and, searching for, the drugs. So, to me, that says introvert, but it's still, there is a need for that support system to help him say, you know what, you've had enough of that, or let's do something else. Let's, having that angel on the shoulder that can help guide.
Well, I think that also taps into a really an emerging theme within medicine that I've seen a lot is more this concept of community medicine, right? And I
Yes.
think we first started seeing it budding within organizations like Alcoholics Anonymous, right? This idea that let us get together, let us acknowledge and humbly acknowledge our humanity and work together collectively to solve for this. And now I think that's also birthing into other models where there's acknowledgement between the healthcare team. It can't be just one doctor. There should be a set, the doctor plus adjunctive healthcare. And then separate to that, groups that are specific to supporting this, not only of fellow addicts or whatever the ailment may be, but also family members that come and hold you accountable, right? There's countless studies, this is an easy example, with weight loss. People who endeavor on weight loss within community have better outcomes than those that try to do it by themselves. And we're
Right.
starting to see that mirror and paralleled within mental health conditions, especially addiction, where you need that, as Dr. Varden put it, I love it, that little angel on your shoulder that taps you and says, I have a different perspective. That's too much. Let's navigate this differently.
Right. And I think, and to hear this might be something that you can weigh in on. I think that, when you look at the AAs of the world and the NAs of the world, celebrities, they're being chased by, these assholes that work for all these, scandal magazines. They're being chased everywhere they go. They go into an AA meeting, it's going to end up on the front page of something, right? And I don't think that they have, I know AA is supposed to be a protected and a private space, but I don't think that there's any protection for them as far as that information being outed to here. Is that true?
Yeah, the issue with trying to provide legal protection is you often don't know who's released that information, and it's tough to find out who's released that info. So listening to what everybody said, I do have a question from the doctors in the room,
Sure.
and that is, Tracy in the beginning talked about the numbers that are very scary. Why is it that a test like the DNA 360 that can pick up these addictive tendencies, it's not the normal thing that doctors do when they're prescribing controlled substances? I would think if somebody's prescribing opioid, right? I mean, I don't need to be a medical professional to know it's dangerous, right? Let's order the test. And whenever you order those substances, like Dr. Smith said, why is it not a normal part of medicine to always engage a team of healthcare, like Dr. Kosterman said, that could take them away from these substances that can be very dangerous into something more holistic? Why is it, we're talking about legal solutions, but it seems to me like this is like the normal thing to do, but why is it not happening?
That
I
is
can answer that. I'm not a doctor. He asked for a doctor.
I mean,
I'll-
it's
I
controlled
can
substance,
agree
it's
with that.
fentanyl, these things are dangerous, they're scary.
Right.
Yeah. Maybe I can speak to the second question first, if that's okay. This idea
Sure.
of why, when someone presents with an acute issue, are we not thinking right away of aftercare? And I think that's a little bit of a medical paradigm, right? You show up to the doctor, you have a broken arm, they fix the broken arm, they're like, great, you're no longer in my scope of medicine. Your broken arm is fixed. And yet we know when the broken arm is hurt, right? It still needs rehab after the fact. You need nutritional support to regrow that bone. You then need physiotherapy to work those muscles, right? There's a lot of different elements of care, but and I mean, for all intents and purposes, that's outside of that doctor's scope, right? But we do not have naturally embedded within our medical system yet this idea of aftercare, that doctor not only needs to prescribe, here is cast and solution for this broken arm. But separately, here I'm going to kick you off into a system that offers you this aftercare. We don't naturally have that within medicine. I think we're starting to get to that place. That's part of the community medicine we talked about, but it's just very foreign to the medical model. The doctor's doing what they're supposed to do, hopefully, right?
Right.
But then there's not that follow-up to support and bolster what was done appropriately.
When alternative medicines really started to gain traction about 20, 25 years ago, and people talked about, well, I'm going to an alternative medicine doctor, we all rolled our eyes. I rolled mine. I'll own it. We all rolled our eyes. When somebody said, oh, I'm going to a functional practitioner, I made fun of that too. But so did everybody else, because there was a very small percentage of clinical practitioners that did look outside their box. I have a patient with a broken arm. How'd the patient break their arm? Is the patient overusing their medication? Those were not boxes they hopped in. But functional practitioners did. The functional practitioner would come in and say, hey, how are you doing? Let me look at the arm. Hey, how'd you break the arm? And it became more conversational, and it became more of a relationship. The average patient is seen for 7 minutes in America. Now, think about anything that's been wrong with any one of you in the last 20 years. Could you spit it out in 7 minutes? Right? So functional doctors spent an hour with a patient at any given time. Well, you can't make that work in insurance. I'm the CEO of a healthcare company. We see patients for an hour at a time. It's ridiculously expensive. But at the end of the day, the patient needs that time, and the practitioner needs that time. If you're going to look at how'd you break the arm, what are we going to do for aftercare? And that's just still not how medicine functions. Now, you fast forward 25 years of where doctors really are embracing precision medicine, embracing more concierge care. And by the way, it's gotten more expensive. Doctors, functional medicine doctors, were $375 an hour 25 years ago. It's $650 an hour on average now. And a lot of people can't afford that. So you take the Matthew Perrys of the world that absolutely can afford that, or you take people like my sister who was poor and schizophrenic and died the same way. The poor person is always going to get sacrificed, because no one's going to pay that $650 to look at all of the stuff that these different people were giving her and saying, listen, babe, you got a problem. And the problem is all of this is going to kill you, and we need to peel this off. We need to titrate you down, and we need to find solutions that are not opioid driven, because you've got a problem. So we don't have that to hear. We don't have people in medicine, by and large, that have that luxury. If you're part of a medical group, and Dr. Smith absolutely can speak to this, if you're part of a medical group, you only have a certain amount of time to see that patient and get to the next one, or you are not going to make the numbers required by the insurance carrier and by the network at any given moment.
Yeah, the doctors have to see a lot of patients to just make their overhead. They're kind of like called mills. You know, you're coming in, checking in. That's okay. Is that okay? The prescription still works for you. Go, and just over and over and over again when you're in that insurance model. And to your question about why isn't the DNA 360 in our healthcare system? Well, the education hasn't changed for our providers.
Right.
You get a little bit, you know, they'll sprinkle a little, oh, this is what integrative healthcare is. Now back to the pharmacology, you know,
Right.
But it's not something that is embraced. And even if there was just knowledge to say, this is your scope, then you look for a naturopathic doctor, a functional medicine doctor when you're done. That is conversation could be had, but it's not. So we are just we're just like etching just a little bit by little bit. We're not moving at leaps and bounds to have that dent in our healthcare system, to make this something that is caught in the very beginning, to identify these things in the very beginning. We're catching people that are frustrated and have tried it all, and they're sick and tired of being sick and tired and want some more answers. That's where we're catching them at this time.
Right.
But as we continue to do the work, we continue to do these podcasts, we continue to speak out on these things, we're hoping to push that needle even more. The research is there, the evidence is there, but we're talking about changing a whole society of how providers are trained or what have you. And I don't have a problem if the healthcare system stays in its box, but as long as it can know when to move it to someone else. And I think that the money gets in the way, the greed in the way. I want to keep you so I can keep getting my insurance reimbursements instead of giving to you, to this practitioner to continue to care for you. Let me just keep staying in my box over and over again. And that's where we keep prescribing and over prescribing, because that's the only tool in the tool shed.
Right.
I would offer, hearing you speak to this, and I think integral to this solution is going to be technology. And why do I say this? So one of your points is doctors haven't been trained with genetics, right? Or doctors haven't been trained in how to integrate with other therapists, right? And there's an element of doctors can only be trained in so much. We can't have doctors in school forever, or else we will never have doctors. And we now know that science and medicine is exploding at a rate that we mere mortals cannot keep up with. And so I would offer, this is really where technology comes in. And I think DNA Company is a beautiful example of this. So when we first started, all of our consults were simply with people, right? And we recognized that we couldn't expand and offer that information quickly enough. There weren't enough people. So we introduced computers to start analyzing DNA and offering the results. It was no longer person bound, it was technology accessible. And so it's learning to adapt, and how do you bring technology intelligently into that consult room so that the doctor does not have to do everything. They're to an extent a very intelligent human integrator of what can technology know, what can my colleagues know, and how do I present that based on my understanding of the person before me to offer them best care possible. And so I think I love what you're saying, Dr. Smith, because I think there's an element we really have to look to our colleagues and become more integrative. But as the soft technologist on the team, I would also offer that also needs to extend to our robotic, to our AI friends, because
I love that.
really going to liberate us,
Mm-hmm.
right? People can only do so
I
much.
agree.
Yeah, and that it'd be helpful with prescriptions too, right? Could you imagine if you have a little bot that was able to go in, comb every pharmacy record, comb every medical record, and collect that for you? So you're no longer being that Sherlock Holmes that has to aggregate all this data. Instead, you have a little bot that was like, oh, well, on September 9th of 2003, they took exactly 10 milligrams of this.
Right. I love that. I think that we want the technology to help support us and make things better. And I love that.
Yeah. And I think the law has to catch up, right? I think the law has to catch up with, how do you quantify intent? How do you quantify culpability? How do you quantify a co-conspirator in a medical case? At what point do we try the PA for criminally negligent homicide? At what point do we get really serious about this? The doctors that we've mentioned here, again, all innocent until proven guilty. The doctors that we've mentioned here only have this many people that are dead now because of their culpability. What about all these other doctors that are killing 220 people a day in the United States? What about the pharmaceutical companies that are manufacturing fentanyl and opioids and all of these other things and are not closely scrutinizing where they're ending up in distribution? You've got to figure the manufacturer somewhere has to know where they sell a widget. I know how many test kits of every single type we offer in this company. I know how many are in the clean room behind me. I can tell you to an absolute level of certainty how many widgets are in my building. So at what level of responsibility does the manufacturer, does the distribution channels, Where's the responsibility? And yes, there's people outside the United States, and we're going to blame it on certain countries, whatever, and they're going to be trucking drugs in here across the border. And now there's a TV show called Contraband where you can see them take engine blocks apart and find drugs in here. It's really rather fascinating. But yeah, okay, so there's always going to be that. But even so, in the United States, the prescription bottles are coming out of a pharmacy. That pharmacy is dispensing and counting every single widget. So again, responsibility. The law has to catch up, and there has to be nuances to these charges, whether it's homicide, whether it's manslaughter. There has to be nuances to it for the people that are also involved. I mean, there was one, Anna Nicole Smith's assistant got like a $100 fine and a year of probation for going and getting the prescriptions in their name. No. I'm sorry. No. That right there, there's collusion. That was collusion. They colluded, right? And that's collusion. And $100 probation.
I think some of the collusion, though, goes beyond just the pharmacies and the individual actors too, right? Mm-hmm. There's collusions within hospital systems. So my sister sent me a podcast and I listened to it, and it was sensational, but it was something by the name of Dr. Death. And it was a multi-part series that examined a doctor in Texas. He was a neurosurgeon who was very poorly trained. And ultimately, because he was not properly trained, anytime he had surgery, his patient was either life-alteringly injured or died. It was very extreme examples. Yeah. And this followed the system that covered it up. And it was hospital-based, because the hospital did not want to admit that they had a doctor that wasn't doing this, because it would tarnish their reputation, increase their insurance, et cetera, et cetera. There was effectively capital consequences to this. So they did fire the doctor, but then they didn't, they still gave him a good letter of recommendation, and none of this was acknowledged. And this podcast followed this person through several iterations of this, and they ultimately did land in jail. But it took, I think, several years, several institutions, and effectively the public outcry that got this person into jail. It was not the hospital that first identified this. It was not the subsequent practices that hired him. All of these people conspired, colluded to cover it up because they didn't want their insurance or reputation to be damaged. And it was interestingly exclusively public outcry and patients' advocacy that landed this person in trouble. So there's multiple paths to the response to this. There's multiple paths to creating a more cohesive way of treating patient zero, whoever patient zero is. And it's not just about celebrity. It's not just about throwing all these people in jail that, bought drugs for Tom Petty or China or, the Taylor Hawkins from the Foo Fighters. It's not just about that. It's about how do we level this playing field for everybody? I mean, the doctor that treated my sister wrote 100% of all of her medications, up to and including 6 different types of an opioid and Xanax, along with schizophrenic meds. Now, Dr. Smith, being your area of practice, you put all those things together, you're going to kill somebody. Well, guess what? They killed somebody. And until I ever get to say it publicly, and I will, nobody knows that. And this guy is a psychiatrist in a major medical system here in the United States, in California, in Orange County, where the rich and shameless live. And he's still practicing. And the system he worked for, in my opinion, quantify, was complicit. Mm-hmm. Because they called my sister's daughter, a minor child at the time, and said, take all those medications back to the pharmacy because they were chemotherapy drugs and they have to be disposed of properly. My sister was not on chemotherapy.
So those are to kind of add on to what Dr. Kosterman was saying. Hospitals will protect these people. They've got a lot to protect. And hospitals, they've got great purpose and they do amazing work. And they are people that will stand a shift that a lot of us will never, ever even imagine. They worked through COVID. They worked through having to have vaccines, and they did all of the things. They did all of the things. So we're talking about very small segments of that population that are problematic. Some of them at my level, at a CEO level, some of them at a clinical level, and some of them at a legal level. But at the end of the day, Matthew Perry was worth saving.
So I wonder to this end, because I want to make sure we're not ending this podcast on doom and gloom and the fact that the system's broken and good luck. Dr. Smith, where, for our listeners, for either someone who might be struggling with this themselves or maybe a family member who's bearing witness to this, what can the patient do? What can the family of patient members do in order to work to the end of preventing this, right? With awareness, it's going to be very difficult, right? Like if you come in with an addiction, you don't want the addiction. It is drug seeking for a reason. Let's not shame and blame. What are your first thoughts on what can the person listening today do to shift this and to protect themselves?
So in that, I feel there's a lot of different entry points into where to answer that question. But let's just start at the beginning where you don't do any medications or that's not your world. But then you have an injury and you need to take a pain pill or a surgery or something like that. And it's in this instance, and it just breaks my heart that then you go get care and find yourself addicted. So the thing is this, there's a couple of type of scenarios where you have individuals that will follow all of the medical prescriptions to the T. You have some that won't ask for help, and then you have those in between. And I think that number one of the things that I always guide upon is always following your gut. So when you are injured, when you are hurt, you still have to take ownership and accountability of you and who you are and how you feel. So what I'm saying is, yes, you've had a procedure, you're going to have pain, you need to take medication. The medication is there to help you. It has its purpose. When it becomes an issue is when we take it and we no longer need it, or we take more than what we need, then that's going to shift our body and how it works. So you have a situation where you've had surgery, it's okay to maybe start very low, take half of a pill or half of what's actually prescribed when you haven't taken anything, and see how your body responds. And then you use that as your guide in how you take your pain medication because it's as needed.
Right.
And then you go from there. And then you can have fear of having this intense pain that you might have not had on day one, where you're trying to prevent that pain from occurring again. So you want to keep taking the medication to prevent that. But as you heal, the pain is going to decrease, and you should not be taking day one prescription levels, day 3, day 5, day 7. You have to reassess where you are. And and I'm talking pain, but I'm talking anxiety. I'm talking any reason that you may take something that is controlled. You want to pause every few days and assess, where are you at still with that issue? And that'll help you with some self-awareness where you can advocate for yourself and say to your provider, you know what, I'm no longer taking that, because I found at this point, Tylenol extra strength works beautiful. Tylenol extra strength with some Motrin, I'm good. But you have to be the communicator to your provider. They're assuming what you need and how much you need, but you have to advocate for yourself. So take ownership and empowerment in your health, where you are and what you feel you need in the beginning when you're getting care, okay? And make sure it's documented. Now, if you're in this situation and you're kind of like, I think maybe I should be taking it off, but I feel so good when I'm on it. I'm able to relax. I can communicate. There's so many benefits if I just keep taking this Vicodin. That's where your community comes into play. So you want to have community and people around you that will, people that are not going to be yes people, but people that are going to call you out and speak to what you need, who you are, what's best for you. Those that truly, truly care about you. It's important to surround yourself with those individuals because as you go through life, they're going to help shift you and bump you back into the lane. And they're teaching you how to do that for others as well.
Yeah.
So community. So listening to yourself, having a strong community are the two things. And then where do I get help if I feel like this just isn't right? I am listening to myself and my family's kind of saying it, but they're being nice. I need some help. And that's when you want to reach out to all your providers. You want to reach out and you just want to start calling people, community, not communities, but like treatment centers and places like that. And you're reaching out and you're saying, I need some help. I need people involved in me. And there's no shame to that. You are being human and we're all struggling. We're all doing the best we can every day. So just get out of yourself. Think about the life that you want and where you want to be, and just do whatever it takes to get there. Take emotion, shame, guilt, whatever out of the picture and get that life. Because you having a good life is going to trickle to everyone else that you love. And it's going to make the difference to preventing others around you from being subject to that as well. And you serve as a symbol that helps to move all of these things we're talking about in this podcast forward.
Yeah, 1,000%. And I
If
think
I
that's
can,
I think that's a great place to go ahead and close this up. I mean, we've gone a little longer than we were going to, and I want to acknowledge everybody's contribution. You guys all did your homework. Tahir, thank you. I know it's always very concerning when an attorney comes on a podcast. So disclaimers will be posted at the bottom. But
Right.
Tahir is my attorney in Canada. And just great research, great information. Dr. Smith, again, stellar. I mean, we have a lot of patients that see you. And because you did take the time to get functionally trained, which is important, you understand them at that genetic level. And I think that that's just a huge bonus for any of our folks that work with you. And of course, Doctors Kosterman and Varden, thank you both very much for your expertise, your research, and your contribution. Guys, our mission here is one more life, right? One more life. And if we can do anything to be supportive in that, that's the ultimate goal for the company. So thank you all for being here today, and we will sign off. Thank you.
Au revoir.
Thank you. Take care.